Good afternoon. My name is Dr. Lianne, and I am a physician here in the United Kingdom. And I would like to talk to you all MRCS candidates, okay? So it is very important when you are preparing for the MRCS to find good resources, to find good teachers, to find good study material also, and also to know a bit more about the exam. As I usually say, know the battle before you actually get into the battle. So today I'm going to be just doing a quick overview of MRCS and mostly focus on Part A. Many colleagues have requested me to make a video on the preparation of this exam, and I will share a couple of tips that have, helped a couple of people in the past. So I hope you are also very well helped. So what's the UK MRCS exam? It's an examination to determine whether a surgical trainee has the knowledge and skills to complete basic training and progress to specialist surgical training. So after usually the foundation year 2, then appropriate candidates are allowed to take the MRCS Part A, and then they can get into either CT1 core training level 1, core training 2, and then they can go into the ST years, the specialist training years. Sometimes the specialist training program can offer an ST1 as opposed to our CT1. So ST1 meaning specialized training year 1, okay, all the way up to specialist training year 6, depending on the surgical program you've applied to. But the MRCS is the beginning of your surgical journey in the United Kingdom. They want to see your fitness to practice. They want to see if you're going to be compatible with the surgical system. Okay, the best way is to analyze a couple of things that you may have ignored throughout your training, especially anatomy. Most people struggle with the Part A. Okay, there are usually 6 attempts that you can make for the Part A, and I believe 4 attempts now for the Part B. And we have a sister video for the MRCS Part B and how to prepare for it. But I want to focus a little bit more on the Part A. Okay. So there are 4 royal colleges. There's one in England, one in Edinburgh, Glasgow, and Ireland. The Glasgow one, I think, is more of physicians and surgeons of Glasgow. Okay, your MRCS is a ticket into one of these programs. Okay, you need the MRCS in order to start surgical training. There is no ands ifs about it. Okay, you have to pass this exam in order to work as a surgeon here. Okay, now one of the biggest things I would recommend, even before you start your journey, you have to go to the intercollegiate MRCS exams.org.uk website to look at their regulations and the formal documents that you will need. Okay, they're very specific about how to apply, when to apply. If you're going to be flying in internationally, you want to make sure that your visa is in order. Okay, if you're already in an FY program, you want to make sure that you can complete your competencies. If you're coming in with some surgical experience, everything is really talked about in this intercollegiate MRCS exams.org.uk website. Another good site for you to go to is the GMC website, and just type in international examinations or requirements for practicing in the UK. You need to get information about what you're about to do. And of course, this platform, I'm using it to talk to both UK trained physicians, but mostly international physicians who may not have background knowledge about this exam. Okay, so a quick overview. All right, you can use the MRCS, get into one of the royal colleges in the UK and Ireland. Okay, you need it to start ST3 training. All right, so if you have some background, maybe a year or 2 in your country in surgery, then you can do the MRCS and start at a higher level of ST3. Okay, it can also be used if you're just trying to apply for other jobs in the NHS, just to show that you have a certain amount of knowledge, or you've actually been in medicine for quite some time. Okay, if you are a consultant and planning to come into the United Kingdom, then you need to actually get in at a higher level. Okay, you may want to do the FRCS. Okay, as opposed to maybe trying other routes like the PLAB exam, MRCP exam. I usually tell the surgeons who consult me, especially if they've been working in a different country, the best place for information, honestly, is not even these YouTube videos, but go to the websites. Okay, go there and send them emails, find out, give them an overview. Of course, you have to start with the GMC and meeting their qualifications first, and then getting some sort of licensure, most probably the full GMC licensure, and then from there you can work your way up. If you want to start with the FY1 route, you can apply through Oriel. If you want to come in as an FY2, you can sit for the PLAB exams. But for surgeons, it's a little bit different. If you do have some practice, you don't need to go through the whole steps of starting FY1 in this country, and you've been a surgeon in your international country. So knowledge is power in this aspect. Okay, to know where you are and how this country can meet your needs, okay, or prepare you to get to where you want to be, right? Okay, back to our overview. In the MRCS Part A, there are two parts, this Part A and this Part B. So you can only do Part B after you do Part A, okay? Part A is a written paper, all right? And the Part B is the OSCE, which is a clinical examination, as I mentioned before. You can get it in our sister video right on our MRCS Strategies YouTube link, okay? We as trainers in the MRCS Strategy company, our main focus is to make this process as doable as possible. There are very many programs out there. There are very many teachers. We recommend for you to find a good teacher. If you work with us, of course, we will guide you even through the process of applications, giving you advice where necessary, and guiding you in the proper pathway, so you're not wasting your time. Okay. Unfortunately, I have met some doctors who've really wasted their time. They've gone through so many routes of getting MRCP, doing the PLAB. It's quite not necessary, especially if you've had a year of experience in your country and you are a surgeon. So Part A, 5 hours MCQ examination. There's a 3-hour paper which is applied basic sciences, and then there's a 2-hour paper which is the principles of surgery in general. Okay, you want to shoot for a high level, guys. Pass mark is 70, but you want to really try and get a really good score. And as I mentioned before, you can get up to 6 attempts for the Part A and 4 for the Part B. What are some of the resources is another good question that I usually get. The basic science for the MRCS, and I have a nice picture of that book here. It's the Andrew T. Rafferty book. You can use that for your revision to supplement questions. Since the Part A is mostly questions, you have to be very proficient in question taking, and also to be quick at it. The more you practice, the better it is for you. There are some very good websites that you can use to help supplement your study. For example, the EMRCS website. There's also Past Test, and I believe there's another one. I forget the name. If I remember, I'll just put it in the comments link. Okay, but you don't want to just passively read. You don't want to just do questions. At least a 60-40 ratio, or even 70-30. Questions are so important, because through the questions, you'll be able to tell your weaknesses. And these websites, especially EMRCS, has a good question bank. Do you need more than one question bank? I'd probably say you can do it with one. But if you really haven't been in practice for a long time and you want to really challenge yourself, I would support the idea of having 2 question banks and a good textbook. Okay, that way when you're not doing your questions, you can always supplement your information, okay, through reading. Give yourself time to study for the MRCS. So I've had people studying for a year. That's too long. 6 months, a little bit on the longer side also. You want to be very structured. When you start, don't stop until the exam. You're better off not even starting at all. This business of starting, stopping, one day you're feeling like it, the next day you're not. At least every day you should practice questions for 10 to 15 minutes. And maybe half an hour of studying. I know we all have jobs, you're trying to balance family, you know, the works of life. But if you're going to set your mind to the journey of studying for Part A, you want to be consistent because you have to keep building on your knowledge. If you're weak in an area like neurology, you don't want to leave that all the way to the a month before the exam. You want to start earlier. Okay, if you're weak in cardio, you want to start that earlier. Weak spots first. You should target your weak spots first in the beginning and then leave the strong points for the end. And of course, you want a month of just revision where you are mixing the questions from different surgical specialties, you know, totally stretching your brain, doing about 2 hours a day of questions straight back to back, okay, so that you can also build stamina. It's a bit sad that people leave you know, the MRCS studying for maybe 1 month before the exam. It's quite risky, you know, it's quite expensive also, and if you're traveling in from another country, then you're spending money on hotels, you're spending all this travel money getting here, and you're not ready for the exam, that you're sabotaging your career. It's straight up, you're sabotaging it. So plan well. I would say maximum 5 months of study. If you look at what you really need to know for this exam, then you might be a little bit more serious. People think it's just doing questions. No, there are actually 10 modules that are assessed in MRCS 1. So the syllabus is divided into 10 modules. Module 1, basic science knowledge relevant to surgical practice. You can say, okay, I have 5 months, I'll do 2 modules a month. I would like to show you what module 1 looks like, okay? This is module 1. Is this the first part? Yes. This is this page, this column here, and this column here are all module 1. You will not be able to cover one module in 1 week unless all you're doing is MRCS. And so for you to be tested on 10 modules, if you are not serious about practice, that's why I said, don't book the exam. Give yourself a chance to pass this exam by being committed to it from the get-go, okay? Now, the next exam is April 21st. Bookings are already done. The next exam date will be September 2020. You know, God help us with the virus that is going on. We do not know whether they'll postpone these dates or whether they'll, you know, push them to the future. But I would still practice with an aim of, if you want to do your exam this year, of getting to September. You have ample time. We are right in the middle of March, okay? I have a nice study timetable that I've created for those of you who are planning for this date. We have a Telegram group where we do questions every weekend, okay? Like a question answer session. A question is given and then you can put your answer and then we discuss the answer afterwards. Those of you who are preparing for Part B, there are also some online mocks that are done in group sessions. So we are here to help you. We are here to make sure that you can pass this exam at the first attempt. But commit right from the beginning. You really have to commit, okay? So here we are, Module 1, basic science knowledge relevant to surgical practice. Number 2, common surgical conditions, basic surgical skills, all the way down to professional behavior and leadership skills, okay? Management of the dying patient, pediatrics, transplants, Okay, so here is how I've made the schedule for those who are planning to have the exam in September. We have 15 more days left in March. You can use the next 15 days to master module 1, okay? And then for April, you can put up 2 modules, okay? So common surgical conditions and basic surgical skills, yeah? Module 4 and 5 for May. And then also maybe the last week of May, you want to go back to module 1, 2, and 3, so you can keep the information current, okay? 6 and 7, assessment and early treatment of the patient with trauma. That's a big topic with ATLS. Surgical care of the pediatric patient, you can put those for the month of June. And then July, you can push the next 3 modules. Management of a dying patient, pretty easy. Tissue transplantation, organ transplantation, professional behavior and leadership skills, absolutely wonderful. So that now you are information heavy at the beginning of your practice, okay? You don't want to be doing module 1 in August. It's a lot, as I showed you before. August, September is when you want to mix the modules. You want to do a randomization of cases. You want to do peer reviews. You want to, in fact, August and September, you should probably not be studying any textbooks. These last 2 months should be mostly question, 2 hours a day, 3 hours a day, 5 hours a day, if you can really push it for that much, okay? And then towards 2 weeks towards the exam, you want to tone it down, quick reviews, okay? And then go in and ace this exam. So it's important to plan your study timetable according to the modules. Let's talk about module 1, okay? So now here, we have applied surgical anatomy, including the regional anatomy, microscopic anatomy, embryology, development, surface anatomy, imaging anatomy. So all your x-rays, imaging, your CT scans, MRIs from head to toe. Okay, this may take you maybe 2-3 days. Here is where now most of the meat is. So your physiological principles. So back into anatomy and physiology. Okay, homeostasis, acid base, sepsis, septic shock, your blood loss, hypovolemic shocks, and now even how the exam is more catered to a clinical experience. So they will not just ask you, you know, this is a CT of the head, what is going on in arrow number X. They may ask it in a clinical setting, okay? This is a subdural hematoma. What age group do you expect this in? Okay, you have a medial meningeal artery rupture. What type of management do you expect this patient to have? So it's more clinically applied. Okay, so why I said module 1 should take at least 15 days is because you have a lot to cover, especially if you have not been in the books for a long time. After your physiology, you're going now into pathology. So there's your wound healing, cellular injuries, vascular disorders, immunologies, chemistry, clinical chemistry, okay? Your tumors, your TNM, grading of the cancers, okay? And then you go into pharmacology. Are you catching my drift? So when people say that they only read for the MRCS for 1 month, I highly doubt, you know, maybe they've been in practice and they have these things and concepts at the tip of their fingers. But for those of you who have been working and studying and maybe not paying too much information to theory, you need time. Okay, module 1 is the most extensive, including pharmacology, microbiome, and imaging, as I had mentioned before. So you see, if you're going to start now, start with module 1. Okay, and I hope that this video is going to catch you in March and not maybe somewhere in June, so that at least you will already have covered up to 5 modules by the time June is rolling in. Okay, if we look down at module 2, Okay, module 2 is also a bit more intensive, but it's more specific to systems. Okay, so we are talking about GI disease like masses, dyspepsia, intestinal obstructions and the management, GI bleeding, rectal jaundice, okay, perirectal disease, acute abdominal emergencies like peritonitis, perforations of viscous, okay, acute presentations of gynae pathology, breast disease, including gynecomastia, tendencies with medications, mastitis, abscess, malignant breast disease, DCIS, okay? Then you get into your vascular disease with your acute limb ischemias, varicosities. It's quite a lot of information. And once you start to understand the modules and what is expected of you, then you'll be able to prepare appropriately. Literally have these modules at hand, okay, and check them off as you go along. Okay, these are now for people who are starting their practice now. You have time to adequately prepare. Module 2 continues on into cardiopulmonary disease, carcinomas, your cardiac failure, your CHD, okay? But look at all this, okay? We're not just stopping at cardio and respiratory, it's going right through into trauma, endocrine, neurology, GU, lymphoreticular systems. Okay, so this is why I really decided to make this MRCS Part A short video just to bring an awareness of what is expected of you in this exam. I would like to post more videos, even going into now the other modules 3 into 10, and talking a little bit in detail about what to expect. So the subsequent videos, we are going to pick a few of the topics that we are noticing most people are failing in, okay, or that are very hard to master, or maybe there's not that much information or teaching online, but I'm hoping that we'll be able to traverse these woods or these waters with you as you prepare for your MRCS. The most important thing is practicing and starting early. Commit, make your plan, okay, and get started. I wish you all the very best in this examination, and look out for the rest of our videos, and join our Telegram groups. We do have our email address. You can always email us. We have a slew of fantastic doctors who are practicing in the NHS hospitals as surgeons who can answer your specific questions. So email us also at mrcsstrategies@gmail.com. But watch out for the next video that comes up on when we start our module 1 training on our basic science knowledge that is more relevant to surgical procedures. Okay. Again, my name is Dr. Lianne, and I'll see you in the next video. Take care, guys.